first one would be to Prof. Zarina. As a pediatrician, I'm sure you come across parents who are anti-vaccine. Wow, this one is a very hot topic, yeah, nowadays. How do you communicate with them?
Yeah, okay. I think indeed it's a very hot topic and it continues to be hot. And I think there is an increasing pool of them actually, to be honest. And I think they all also use the media. So,
Correct.
right? I think you have to engage them lah, yeah. You have to engage them and find out what are their misconceptions lah. So when you engage them, if you know particularly, okay, let's say it's an anti-vaxxer, they are the different levels. So who do you engage? You engage your patient, you engage the group. So sometimes when you are on the day-to-day work, right, I have come across patients, right, they come in because they have not vaccinated their children. So you have to engage the mother and the father, and you have to find out what's the root of the problem. Okay, so you have to then remember when I said spikes about perception, you have to actually understand what is it that they are worried about. So when you actually explore what they are worried about, then you have to then use your knowledge, right? And try to mention what is it. Those are all then just myths, okay? For example, they're worried about something, injection can cause autism and all that, right? Several serious conditions. Then you have to be knowledgeable and dispel that myth, okay? And of course, that is talking about individual basis. But what about at large, right? I think then you have to do like what Datuk Zul then do now, right? Number one, you communicate at the patient level, right? Then number two, then you become a health advocate, right? Datuk Zul.
Yeah.
So then
Yeah,
you will
betul.
have to use either you yourself or a team, right? And then increase awareness. Then you play the role. Remember we said media and all that, because you know there's only so much that you can do between one to one to the family, right? But you need to engage more people, and then that's where you become a health advocate.
Yeah.
It's not easy, I agree, but I think it's not a one-off process. It's
Yeah.
got to be repeated processes. Yeah.
Prof, kalau I boleh tambah and share kan, Prof, it's the same thing. Like for me kan, in my field, we've been fighting a lot with people who like go for urut batin, for ED kan. Beli minyak lintah untuk enlarge the penis, injection testosterone untuk jadi sado. So these are the problem that is in the community. And then macam you cakap tadi, it's difficult to advise satu patient. And when they come, normally when the patient come to us, it's too late already. For example, dah pergi urut batin, datang dengan pinna fracture, you cannot do anything kan. Pergi cucuk testosterone, come with testicular atrophy, is too late. So you just share this experience. So that's why you always have an issue to share sebenarnya. Not only at our level, tapi it's actually at the medical officer level pun, of course, there are issue to share. And then, of course, before that, you have to be knowledgeable yourself lah, before you become a health advocate, kan? Yeah.
Okay, thank you very much, Prof. Zarina, Prof. Zul. Okay, we have another question here from Dr. Ashiki Muhammad. She was asking about opinion on what is our approach when the patient asks about the risk procedure objectively. For example, percentage of success of complication. And although that we know it is subjective, patient and operator dependent on factors. I think maybe Prof. Zarina can comment after that. Maybe we can advocate how to do this.
Oh, okay, all right. So let me see. I'll read the question. So when you talk about a procedure, right? Okay. I think when you explain, right, there will always be risks and benefits, right? And when you talk about risks and benefits, right, of course, if you're talking about a life-saving procedure, yeah, I am just wanting to share. I do genetic counseling, okay? I'm a clinical geneticist. In genetic counseling, right, it is non-directive counseling. However, when you do this type of counseling, you still have to talk about the risks and benefits, right? And the benefits you have to be, if it's a life saving, of course you akan emphasize on that a lot, right? But you cannot just not mention the risk at all, right? Because how will you know that the risk, let's say if it's a 2% risk, right? Can you tell that the patient in front of you is the one who's the 98%? That will be difficult, right? So for all you know, because you didn't mention it, right, that patient falls under the 2%, right? So I think it's all about, remember I talked about disclosure just now, it's open disclosure. Because once you are not, you want that person to go. So if you counsel properly and you really talk in about the benefits, yeah, inshallah, they will do whatever procedure. But you cannot not mention about the risk. Because if that risk happens, right? And yeah, you're right, it's operator dependent and all that. But we always make sure that the right person and the best person does that job, right? Okay, we're not going to send the most junior person, right, to do a very high risk surgery or something like that, right? But you have to, because nanti if something bad happens, then you open the door to mediation, litigation, because you did not communicate well. So maybe I'm sure Prof Azhar or Datuk Zul want to share pun, because it's quite an open area.
Yeah. Yeah, betul, Prof. Actually, whatever the risk is, we need to talk to the patient. So that's why sometimes kan kita tak boleh nak send the junior most people to go and take consent. And then again and again and again, we need to document what we write, what we tell the patient. Because as you mentioned just now, Prof. Zarina, in this orang kata era of litigation, memang sikit pun akan jadi isu. For example, macam for me kan, the most common procedure is TURP, transurethral resection of the prostate, with 90% chances of retrograde ejaculation, but maybe about 5% risk of ED. But you need to tell the patient, because sometimes patient have left ED after that, the lawyer will come with that 5% and harm you forever. So even though you know that ED might not be caused by that, so itulah, and in front of them it's quite difficult to discuss without any documentation. So that's why again and again for the younger specialists to be document everything. That is very important, because the issue might not come out tomorrow or the day after. It might come out 3 or 4 years after. Then these are the things that we face nowadays.
Totally agree with you, Prof. Actually, I will always say that you can fall to the maybe the least 1%, but we don't know who's going to fall for
Yeah,
that. Yeah,
yeah,
so that, I
that's
think that's
right.
how we actually take all the consent in all
That's
in
right.
our during our daily daily work.
Yeah, and
Okay.
we cannot always say, I dah cakap kat you, I dah cakap kat you.
Yes,
Cannot.
true.
It won't happen. Yeah.
Yeah, it won't happen, and it will not
Huh.
hold in the court also.
Yeah, that's right. And then some of them have a lot of family members. Sometimes you tell one brother, but the other brother is not there. Then all this chaos will happen, you know. So that's why I always document things that you say. Yeah.
Yeah, it's actually true. Okay, we have a few more questions here from Dr. Siti Nadira. In some instances, especially when we are counseling patients for or parents for treatments that they are not keen for, some do become emotional and aggressive in declining the treatment. How do we approach that? Uh, Maybe Prof. Zul can start the ball rolling. Uh, Prof, sorry,
Okay.
Prof.
Yeah,
Okay.
it's okay. Yeah. Of course, the principle is that you cannot fight fire with fire. You have to, be the water, and then the most important thing is to listen. You don't answer back. You know, just keep everything calm. Listen to them. What are the things that they want actually? You know, by all means that they doesn't want to go through any of the procedure and all that, again and again I cakap, we got to document, discuss with patient, discuss with who and who, tulis kat situ, does not agree for treatment. Itu aja. You know, at the end of the day, it's their choice, it's their body. But of course, before that, we need to educate them, we need to advise them. But at the end of the day, it's their choice. Yeah. maybe Prof have a lot of experience with parents who are aggressive parents.
Well, I think I totally agree with Dato' Zul, not fighting fire with fire. Okay, so I think as best possible is to remain calm. Okay, and there must be something that is triggering them, because you have to remember what is their background. You may not know. For all you know, that person may not really be angry at you, right? There could be some circumstances behind them that is making them angry, right? For example, you know. Because I used to work in the oncology setup in the oncology ward, pediatric oncology. So there might be somebody who doesn't want to do the intrathecal medication, right? So they get very angry and upset, right? And when you explain, and actually, I think you have to try and make the condition a little bit more calm as far as possible. Acknowledge that they are actually angry. You know, I think that's fine. You can say, I see, I can see that you're getting rather upset about this. Is there something that is making you upset about it? Perhaps I can actually assist and answer your queries. I think I can understand why you are feeling this way. So you need to acknowledge that they are like that. Okay, and you know, don't when they raise their voice, you start raising your voice. I can tell you that that patient is going to walk out of the door,
Yeah.
and that's it. Okay, so I think, and if you find that you're not getting anywhere, then perhaps you have to still document that you have done certain things, and then maybe let's see what it is. Maybe that's not the right time yet to make that decision, depending on how critical, because there are many things that we can't, many scenarios, right? So you have to think. So maybe they need another time that they need to come back and think about it. Maybe it was something else that triggered them, right? That they need to solve first. So you need to come back again, right? And see how. And of course, sometimes if you are not able to do that, right? Because you cannot handle, let's say that you were somehow asked to do something and you can't mediate that, right? Usually angry parents and etc. If you're not able to handle, the next question, if you are in training, then you go up the ladder, right? You call the specialist or the consultant. Okay, you have to remember, because a lot of this do take a lot of experience. Even the older people like me and well, not Zola, we were still learning, right? Okay, so sometimes masa family conferences, right, when there are issues, sometimes sometimes you may already sense that there is trouble brewing, right? You can sense, right? You're thinking they don't want this, they don't want that, so it's time to call for a family conference. So you initiate that. So when you initiate that, you already have people who can be there to answer the questions. Okay. So you have to anticipate lah, right?
Thank you very much. Actually, I totally agree with both Prof. Zarina and Datuk Zul. Uh, uh, you are not actually old, Prof. Actually, you are wiser. That's the correct word. So all of us, I think, learn throughout our career how to handle these things. It's not easy, but we will learn when we go through it. So this is a very, very good learning process. So the senior you are, the wiser you are, you have more experience, and I think that counts. Yeah. Okay, we have another question here from one of the participants. Was asking about communication can be very difficult when it comes to correcting any error or mistake made on the floor with fellow colleagues, more so when it's your superior. What's the best approach in this matter if dispute occur? Rosarina, maybe you want to answer this first?
Ya, saya rasa saya macam Baiba. Okay, so Baiba both say. Okay, so you talking about a mistake has been made, right? And a mistake involving somebody senior to you, right? That's the way I understand the question, right? Well, okay. I think first of all, you have to verify that the mistake is a real mistake lah, okay? Because sometimes it could be miscommunication resulting in something that, avoidable. But if you have actually verified that there is a mistake, no matter how big or small, because you're always talking about potentially impacting patient safety, right? If you are not happy to speak to that person, right, because you are now in training, right? And if I speak to this person and I report this person, I might be in a position where I may not progress in my study. No, I'm just trying to think of this. Okay, so I think you will have to engage another person then, right? To me, because if it's
Sorry,
a
Prof. Zarina, you're muted. We
huh?
can't hear you. Prof. Zarina, can
Oh,
you hear us?
can you? Yeah, yeah. I'm
We
talking.
can't
What can
hear
you?
you.
I can hear Prof. Zarina.
Oh, who cannot hear me?
Can Prof.
Can okay. So I think if you
Oh, suddenly
are
saya punya rupa pun dah jadi bertukar.
okay, there's some mysterious forces today.
Yes, since yesterday, isn't it, Prof?
Oh yes, yes. Okay, since yesterday, correct. So
I'm sorry, I think all of us is muted.
Okay, but I can hear Prof. Zarina very
But
well.
I hope the other participants, can you type
we
whether
are
you can hear?
trying to
Can the participants
solve
type?
this.
Okay, but can the participants type? Let me type something. Not type.
I can hear.
Yeah, yeah.
Can hear.
You can hear, yeah. So maybe
Yes.
it's at the telesidang.
Very well. All of you, we can hear you very well. Termasuk Azhar. Maybe it's
Ah,
a teleconference, a telesidang.
Can you all hear me? Prof. Zarina, can
yes.
Prof.
Yes,
Zul?
Yes.
Can.
Yes.
yes, we
Because
can
I
hear
can't
you.
hear you.
Okay.
Okay, maybe Bokhari can see
I can't hear you.
To moderate.
Okay. Maybe I will just okay, there's some suddenly got 51 questions here. Yeah, are they asking loud and clear? Thank you. I think the 51 responses are loud and clear. Thank you. So while Prof. Azhar is trying to sort out the technical part, I think Prof. Zul and I
Okay,
can
I'm going
continue.
to move to the other laptop.
Okay.
Okay.
So we will just continue first, kan, Zul?
Yes. Yes, Prof.
Yes. So the question is, if it's a senior, a superior, and I think if it's a mistake, especially if it's a grave mistake, right? I think it still has to be brought to attention, right? And I think if you are concerned about how it will impact you, because I don't think you'll be comfortable telling that particular senior maybe, or your lecturer, that excuse me, you have made a mistake. Then you probably have to engage. You have other specialists around you, right? You have mentors, all right? Okay. You hopefully along the way you will build some trust in some and a close relationship, good relationship rather than close, with some of the lecturers. So you can actually speak to them, right? I don't think you should feel that you are, guilty of tattletale, especially if it's something that is grave, because then it comes to attention. Because remember, you are trying to protect that person. You are forgetting that you are not protecting the patient. Okay? Because remember, your role first here is to the patient. Okay, so I mean that's my take on it lah, yeah. So, Prof. Azhar can hear us now? Not yet. Okay.
Yeah, I can hear already because I
Ah.
changed to the other laptop.
Okay.
The spare laptop.
Okay. So I have answered that question just now,
Yeah.
Prof. Azhar. Yeah.
Yeah.
Yep.
So I think we have a few. I really hope that we can answer all the questions
Okay.
from the participants. But I think we have to choose a few more questions, and then because of the limitation of the time. So I would okay. This question from Dr. Farhani. In case like Jehovah's Witness, yeah, I think this is one of the quite a famous case scenario also currently, where she or he refused a blood transfusion in emergency department. How do we proceed from here? And we just need to document and just follow the patient's wish, or we should proceed with the procedure because it's life saving, or can we get sued because of that?
Waiwan ni susah nak jawab. Prof, you ada experience. I have not had any
Okay.
experience.
To be
Maybe
frank,
you bro.
yeah. To be frank, we have come across to
Uh,
a few Jehovah's Witness going for surgery itself.
so meaning
Um,
that they are Jehovah Witness here in
yeah.
Malaysia.
Apparently,
Oh,
there's quite a number. I think this
wow.
year we have like 2 cases of Jehovah's Witness. So what we did is we do acknowledge them. What is their concern about their blood transfusion and all the Jehovah's Witness have also a different kind of I would say things that they will accept. Some of them totally don't really want anything, but some of it can say some plasma, it can be transfused. So we really have to inquire more which stream they belongs to. So with that, we discuss with them. We do tell them what are the risks and of course what are the benefit also if we were to transfuse blood or blood product to them, and what are the consequences, like Prof. Datuk Zul and Prof. Zarina, so they emphasize we do document that. And then after all the documentation, then we discuss with the patient, but it's always like Prof. Datuk Zul said, the final decision is from the patient. So we do come across a patient last time who's a minor, whose parents is a Jehovah's Witness. So with this, because it's involve a minor, it's more, the litigation of it is quite difficult. So what we do is we do rope in our legal officer to advise us in how to come about with this. And we, after the counseling and also the documentation, we sit down with the parents and the child and also the legal officer. Then we actually uh, proceed with the procedure. It is a neurosurgery procedure. It's quite a high risk tumor at that point of time. So we do proceed with the when everybody has agreed to for the risk. And as for the practitioner, actually, from my limited knowledge and from my readings of the Jehovah's Witness, we actually can refuse not to give, like me, to anesthetize the patient, right? But and then we always discuss if there any of our colleagues is actually quite comfortable to do the case. So I think this came to the communication not only from the practitioner to the patient, but in between the practitioner itself, we can always communicate. So that is my experience with the Jehovah's Witness. I hope that answer the question from the participant.
Prof. Azhar,
Yeah, yeah,
Prof. Dayang here.
yeah, Prodaya.
Perhaps I can share my experience of
Yeah,
treating Jehovah's Witness when I was in Australia,
definitely.
which I think is very useful to be shared with the participants. Will that be all right? It's very
Yeah,
quick.
yeah, definitely.
We had a teenager who fell from horse riding while horse riding and sustained severe injury to the liver. So naturally, the liver fractured and the child was on had hypovolemic shock from bleeding, and both parents and the child is Jehovah's Witness. So I totally agree with you that it needs discussion, but it was done at a hospital management. So these are the apa tu sentinel event we call it. And tomorrow's lecture on incidents reporting, there is a type of incidents called sentinel event. A sentinel event means if you don't do something or alert the highest authority of the place, the patient can die. Yeah, it has, and the error can occur individually or through the system. Yeah, so it became a Jehovah's Witness in emergency is a sentinel event, which means the hospital, top hospital management, the director needs to be alerted, and the highest consultant, the most senior consultant needs to be informed. Yeah, and they have to come down. It was in the middle of the night. I was the registrar on call, and we had to have emergency discussion on Jehovah's Witness refusing blood transfusion, and that occurs for every single time the patient and the parents refuse blood transfusion, and they survive. And in this particular case, they wouldn't even want plasma. They wouldn't even any blood products. They are very strict Jehovah's Witness, and the child survived uh, with bile leak, and we had to manage the complication. So I think in essence, this ties up to what Prof. Datuk Wan Zorina was mentioning about risk management and risk assessment. So I hope she did mention that sentinel event and incidents reporting is part of risk management of the hospital, and it should be addressed very seriously. And that's all, Prof. Azhar. Thank you.
Thank you very much, Prof. Dayang. Yeah, I think that is a very good approach that she has shared with us her experience in Australia.
Zarina, can I add on?
Yeah, can definitely,
About
Prof.
J
Dekan.
about JW. It's a bless for me to engage with many hundreds or even many JW, taking the history as a student, as a junior doctors, as a mid rank and a consultant, and on many aspects, procedures and so. So in overseas, they are dedicated PUU, pegawai undang-undang, who are dealing with the consent, and there will be a risk stratification of the surgery, for example, abdominal surgery or little procedures, cystoscopy, endoscopy. So there are risk stratification. Number two, we really have to explain to them, and there has to be present by at least the senior registrar rank. There's not lower than that. Number three, of course, the case of major surgery, required blood transfusion, there will be always a medical legal in the institution that can ring over the phone or online with the JW patient's lawyer in the case of required blood transfusion if the emergency problem. So it's a very important that both sides of the lawyers, the hospital lawyers who protect the doctors versus the lawyers who also protect the JW witnesses. So because they're becoming legal, you cannot be verbally consent. And I think the practice has to be top-notch, without zero complication. But I have seen a JW, even though they are not consented for the blood transfusion, but in the event of required whatever fine, they will actually resign the consent because we allowed the JW relative to see the patient maybe semi-dying or maybe have a hypotensive, losing blood. So in the event of that, they resign the consent. But there has to be brothers or sisters, may not be, cousin or the other family who is registered in the medical record as a next of kin. Very important. Because you cannot simply take a sister who are living in New York, just come and she is not listed as the next of kin in the medical record. So it's not legal. So I think it's a good practice, but medical legal rate in our country is very low, but I think it's increasing slowly. So I think we should adhere to the best practice. Itu saja my comment, Prof. Zarina.
Thank you very much, Prof. Dekan. Listen to your answer. I think that's what the textbook tells us. So I think it's a very, very good explanation from first-hand experience. Yeah. Okay. I think there is a lot of questions, but unfortunately, we don't have the time to answer all these questions. But I will try to get if possible, maybe from the panelists and also from the lecturers today to answer it separately, and then we will maybe we can have a platform how to answer this question. Before I end this session, there is one question to our Prof. Dekan, yeah. For the first question, it's not been answered. So I think I would like to address this question to you. So it seems from one of the participants, there is no name was written there. So it seems that good communication. Sorry, not this one. The first one. Okay. this question was regarding Prof. Raja Affendi lecture regarding the life circle of a postgraduate student. Some of us are significantly older than the rest was just start the postgraduate journey. Any specific advice for this regarding future planning, as even though we all want to be ambitious, but we have to be realistic in terms of time? Prof.
Thank
Dekan.
you. Response number one, age is just a number. Response number two, it could be biological age, it could be chronological age. If you look at from Datuk Mahmud, he looks like in the 40s, but he's not 40s chronologically, but biologically he's very healthy. Same with Datuk Zul, same with Prof. Zarina, same with Prof. Zarina. So I don't think any contraindication to pursue your ambition with your age, number one. In some country, I think in New Zealand, there is no retirement, you know. But of course, we have to be realistic. If we look after our healthy lifestyle, if we measure all this routine practice for ourselves, and at the same time, we have to be realistic. Maybe we just set our target. I just want to do Doctor of Internal Medicine as a general surgery, and that's it. There's nothing wrong with that. As long as you pass your general surgery, you know, you can work as a specialist in Sandakan, in Gua Musang somewhere. I think you are contributing to the community. There's nothing wrong with that. If you decide after your Doctor of Internal Medicine, I say, okay, after gazettement, I want to do PhD in thalassemia. Why not? You know, you spend 3 years, you get a new knowledge, new expertise. Again, you're contributing to the community in different way. That's not an issue at all. I mean, maybe we are not familiar that yet with the graduate entry medical student. In some country, this medical student have a PhD already or have some Master of Science. So they're very mature medical student. And when they become medical officer or senior house officer, they have Master of Science, they got degree of primary degree in medicine, they also got PhD. And I found these creatures are very responsible. It's not like 4:50, they finish shift at 5 p.m., 4:50, they walk down to the car. No, they really hand over to their colleagues who's coming for the on-call, hand over, they become very responsible, they become very mature, they become, you know, very wise in the early stage of the career. So I think it depends what you want. If you think after 4 years, you want to be a generalist, general specialist, in which we have plenty in Malaysia now, why not? That's okay. But think about nowadays, having the degree is like having the diploma. Having the master is like having the degree. Having PhD is like having the master. So the world is changing. You know, that's why I said early on, nowadays, great is no longer good enough. We have to be melampaui kehebatan, so that our country, our region, need a really super specialist, clinician scientist to engage, to know, understand the precision medicine, artificial intelligence, digital healthcare towards the betterment of our region. Thank you. That's all my comment, Prof. Zaina. Thank you.
Thank you for very much, Prof. Dekan. With the wise word from our Dean, I would like to end the session of day 2 of our webinar of PPD